Hi, my name is Brittany. I'm a second-year F&P student at Radford University, Carilion. I would like to do a head, ears, eyes, nose, and throat and skin assessment on you. Can I get your permission to perform an assessment and record it for others to see? Okay, I'm going to go ahead and wash my hands. Can you tell me your name and date of birth?
Randall Creasy, June 3rd, 1985.
Can you tell me what year it is?
2019.
Can you tell me where we are today?
I'm Anita at the doctor's office.
And what are we doing today?
Physical exam.
So the patient is alert to person, place, time, and task. Are you having any pain today?
No, ma'am.
So the patient does not have any pain. If he was, I'd ask him to rate it on a scale of 0 to 10. So now we're going to go ahead. I'm going to look at his skin. So his skin is warm, normal pigmentation, no redness, no lesions, no ulcers or anything like that. Skin is warm, it is dry, texture is soft and smooth. Skin turgor is good. So his skin is good. So I'm going to go ahead and go to his nails. So his nail beds are pink. Capillary refills less than 3 seconds. No ridges, no irregularities, no clubbing or anything like that. Nail thickness normal throughout, and the firmness is normal throughout. Textures of nails is kind of soft, flat, and convex. So now I'm going to go ahead and go to his head. So his head is symmetrical, normal anatomic position, no swaying to one side or the other, no kind of protrusions or anything like that. So his skull is symmetrical, normal shape, normal size, no abnormalities noted. Scalp is free of any kind of lesions, ulcerations, no kind of nodules or nits or anything like that. I'm going to go ahead and palpate. So his scalp moves freely over his skull. He's not having any tenderness. No nodules on palpation, no kind of signs of any trauma. It feels symmetrical, normal shape and size. So now I'm going to go ahead and look at his facial features. So facial features are usual. I don't see any kind of unusual facial features. They're symmetrical and in line with normal anatomic position. I'm going to go ahead and palpate his frontal sinuses. And you tell me if you have any pain. Okay, so frontal sinuses palpated over the frontal bone. He's not having any pain. Maxillary sinuses over the lateral aspect of his lateral wall of his nose on the maxillary bone, kind of push up on the zygomatic process. So he's not having pain when palpating sinuses, but if he was, I would, so he's not having any pain, so that shows me there's no inflammation or obstruction, so the sinuses are probably patent. However, if he was having pain, I would do the trans-elimination to see the patency of his sinuses. So next I'm going to go to his head and neck. So his neck is symmetrical. I don't see any kind of protrusions or unalignment, no excess thickness. It's normal skin, normal shape, normal size. If you can go ahead and flex, extend your head back, flex your head forward, lateral bend to one side, lateral bend to the other side, rotate to one side, rotate to the other side. Good. So his range of motion is good and normal. His trachea is midline. It's not deviated. It's symmetrical. There's no nodules, no protrusions. His carotid artery on inspection, I don't see any kind of pulsation, so that's good. I'm going to listen with the bell of my stethoscope for a bruit. Good, and I don't hear a carotid artery bruit, so that is good. So now I'm going to go ahead and look at his thyroid gland. So if you can tilt your head back and swallow. Good. Now take a sip of water for me. And swallow. Good. So his thyroid gland is not visible, so that's a normal finding. So now I'm going to palpate his thyroid gland. Go ahead and take a sip of water, but don't swallow until I tell you to. So I'm going to use my thumb and kind of push it over. Swallow. All right, and the other side. Swallow. Good. So his thyroid gland was small, firm, no nodules, no tenderness, normal shape, normal size. So his thyroid gland appears to be good. So now I'm going to check his lymph nodes. I'm going to go ahead and palpate his lymph nodes. First, I'm going to start with his typical lymph nodes at the base of his skull, his post-ocular lymph nodes behind the ear, his preocular lymph nodes in front of the ear, his parotid and retropharyngeal lymph nodes at the angle of his mandible, his submandibular lymph node between the tip and the angle of his mandible, his submental lymph nodes underneath the tip of his mandible. And then I'm going to go and palpate his anterior cervical lymph nodes at the sternocleidomastoid muscle. And then his posterior cervical lymph nodes at the anterior ridge of the trapeze muscle. His posterior cervical lymph nodes deep into the sternocleidomastoid muscle. And his supraclavicular lymph nodes between the clavicle and sternocleidomastoid muscle. So on palpating his lymph nodes, he had no tenderness, no warmth, no redness, no swelling. I did not feel them move. I did not notice any kind of enlarged lymph nodes. I did not notice any kind of tenderness or nodules or palpations or anything like that. So lymph nodes look good, normal character. So now I'm going to go ahead and go to his eyes. So if you go ahead and close your eyes, so the external eyes, they're symmetrical, normal, congruent. He's got brown, coarse eyebrows that run around the top of his eyes. I forgot to mention that his hair on his head was brown and coarse and intact, no kinds of signs of alopecia or hair loss. Now back to his eyes. They're symmetrical, no kind of drainage, no kind of edema or anything like that. No nodules on palpation. His orbital area is no edema or anything like that. Periorbital area, no edema. You can go ahead and open your eyes. So external eyes look intact. So now I'm going to go ahead and check your conjunctiva. If you can kind of just look up. So conjunctiva is pink and moist, no redness, no exudate, no cobblestone appearance. Sclera is white, no jaundice, no redness. Cornea is clear, no blood vessels. Pupils are about 3 millimeters. If you can go ahead and look straight ahead. Good. So pupils are equal, round, reactive to light. And just watch my pen light. Okay, and they also accommodate. So that is good. Now I'm going to go ahead and use my ophthalmoscope and look at his eyes. First, I'm going to start with my lens at 0, and I'm going to use my right hand to look at my right hand and right eye to look at his right eye. And my left hand and left eye to look at his left eye. Good. So I did notice a red reflex. I did see his fundus, and I did see blood vessels, so that is good. So I'm also going to check his extraocular motor. If you can just follow my pen light to all 6 fields of gaze. So I didn't notice any kind of rhythmic jerking or anything like that, so that is a normal finding. If you can just look straight ahead, I'm going to shine this light in your eyes. Good, so corneal light reflex is symmetrical in both eyes, and that is a normal finding. So now I'm going to go ahead and look at his ears. So his ears are symmetrical, normal position, normal shape, normal color with the face. I don't see any kind of redness, no lesions, no ulcerations. When I palpate, there's no lesions, no nodules, no pain. His mastoid process, there's no nodules, no lesions. He didn't have any pain with palpitation. So next, I'm going to go... His landmarks on his ears look normal, so his external ears look like in good position. So now I'm going to go and look at the auditory canal. I'm just going to kind of hold the otoscope between my thumb and my index finger, and I'm going to kind of pull his peanut up and back. Good, and if he was a child, I would pull it down and back. Good. So his tympanic membrane is translucent, pearly gray, no protrusions or obstructions. Auditory canal was pink. I didn't see any kind of lesions. I did see mild earwax, no kind of ulcerations, no foreign objects, no drainage. So his nares is symmetrical, normal color of face, no kind of no nasal flaring noted. It's symmetrical. I didn't see any kind of lesions, no ulcers. No nasal deformities as far as like bone and cartilage. That all seems to be intact. I'm going to go ahead and look inside his nares. Good. So his septum is not deviated, it's not protrudes, it's intact. There's no bulging, no bleeding, no crust or anything like that. There's no foreign objects, no drainage, no obstructions in the nasal airway. They're pink and moist. His inferior and middle turbinate is intact and firm and pink. His lips, external and internal, are intact. They're symmetrical, normal shape and size. I don't notice any kind of lesions or ulcerations or anything like that. If you can just open your mouth. So his teeth are ivory. There's no missing teeth, no loose teeth. Gums are pink and moist. No nodules, no ulcers, no lacerations. Tongue is pink and moist. No ulcers, no nodules, no lacerations. Uvula is midline. No ulcers, no nodules, no lacerations. Hard plate and soft plate is intact. No nodules, no ulcers, no lacerations. Normal shape, normal size, normal character. No drainage out of the mouth. Tonsils are intact, but they're pink and moist. There's no enlargement. There's no exudate. We already said tongue, and we already said gums. Buccal mucosa is pink and moist. No lesions, ulcers, or anything like that. If you can go ahead and stick your tongue out for me. Good. So tongue did not deviate to one side or other, so that lets me know his hypoglossal cranial nerve number 12 is intact. Now, I'm going to go ahead and elicit your gag reflex. So his gag reflex is present. So that lets me know that that's intact. I think I did not check your nasal patency, so if you could just close one nostril and breathe in and out. And the other one. And we need to do the whisper test. I'm going to stand out of field of vision. If you can repeat what you hear.
S3F.
S3F.
T3F.
Good. Alrighty. I think we're good.